According to a circular to media this morning, the LSK KNCHR mediation team hit the ground running after Wednesday's court ruling and met to see the way forward for KMPDU and government talks to continue. While they prepare for that meeting, documents seen by NTV paint a clear picture of the KNCHR statement earlier this week on the 90% agreement that had been reached by the two parties. Among the terms and conditions under discussion over the weekend, the agreement would be effective 1st July 2017 and shall remain in force for a period of 4 years until amended or reviewed as provided therein. The doctors disagree on the existence of such a document.
So there was no agreement ready to be signed. However, they had talked about so many things in that CBA and they had agreed on very many things in the CBA. There were very few areas remaining to be tackled by the time they were finishing the meeting.
According to the documents in our possession, doctors would retain the current job grade categories as set out by the Public Service Commission. The entry level for intern doctors would be set at Job Group M. Consequently, doctors in Job Group M and above would move one grade up. On salary increments, the parties agreed that this will be at the rates provided for in the different salary scales subject to guidelines by the SRC. The agreement would also ensure that the medical fraternity would get house, commuter, non-practicing, medical risk, extraneous and doctors' allowances.
And I think it is important to note also that at that time when they were talking, the union team was complete. The Kenya National Commission on Human Rights Mediation was there. The Ministry of Health had sent people who, as we have heard from the minister and the PS, were not people who consider themselves to be in a position to agree to anything or to sign anything. And of course the Council of Governors was not there.
Doctors would also get call rooms, doctors' rooms, 48-hour weeks and compensation for each public holiday they were on duty. The employer would ensure that all facilities provided to them were safe in accordance to Occupational Safety and Healthy Act. The employer would also ensure that all facilities provided to them were safe in accordance to Occupational Safety and Health Act.
As long as the other party, the government, is honest in its dealings and is sincere, there is always a possibility that an agreement can very quickly be reached. But then you go to social media and you find government employees posting on social media that they are going to reveal all the minutes of all the mediation and so on. And you ask yourself, is this good faith?
Even as doctors prepare to go back to the negotiating table, the public healthcare system is literally walking on eggshells as nurses are now giving notice that come the 3rd of March this year, they are downing their tools and going back to the streets if the CBA is not implemented.
Today, these officials travel from across the country to come and negotiate, only to arrive here in Nairobi and they are told the meeting has been called off.
Leila Mohammed, NTV.